due to have a discectomy called my L5S1 herniation. Consultant wants to hold due to improvement, but still in pain. That sounds like a good thing, Amy. That sounds like a good thing. If you start doing the rehab work and you start noticing improvement, they don't want to rush to do operations. You can always have the operation later. You can't unhave the operation. Everything involves risk. I would suggest make sure you're doing the right sort of rehab work. It sounds like they've been a really responsible surgeon, right? Or consultant. You know, if you're making improvements, they want to be reluctant to do surgery. The last thing they want is you to be a patient that was on the up, right? But you're still having pains. You haven't healed, right? These things heal in months. One of the very important things for you to understand, Amy, which you might be at risk of falling on the wrong side of this, is when they do something like the discectomy, right? That is not the problem. They're going to cut that out. The problem is the fact that your annulus fibrosus, which is the ring that holds that bit in the middle in place, is broken. It's damaged. It's torn, which is why we have the disc bulge. They cannot repair that. They're not repairing that, right? They're cutting the bit of disc away. You still have an injury. So if the expectation is that we're going to, oh, they cut it out and I'll be good as gold, no. And if you're already making progress and these fibers are starting to heal up, starting to restore a bit of stability, but you're still in pain, like that's good news. It takes months for those things to heal. They are slow tissues to recover, right? And I think that's what they're doing, a responsible thing. Hopefully they're giving you some guidance on the rehab front. If you haven't got that guidance, check out the program. It'll help you. Just really continue to make the good progress that you've been making already.